You're listening to episode 14 of Present Moment. Welcome to Present Moment, Mindfulness, Practice, and Science. I'm Ted Meissner. Present Moment is a podcast with interviews, conversations, and roundtable discussions. We speak with mindfulness researchers about their newest findings published in peer-reviewed science journals, teachers about their understanding and methods as they work with students of mindfulness, authors about their books and interests, and we also speak with everyday practitioners. The website presentmomentmindfulness.com has show notes for each episode along with resource materials. Dr. Ron Siegel joins us to speak about his book for using mindfulness to help with back pain, Back Sense, a revolutionary approach to halting the cycle of chronic back pain. For many of us, chronic pain is an ongoing challenge to how we relate to the world, our loved ones, and even ourselves. Our mindfulness practice can help us change our relationship to that pain, opening the door to experiencing sensation rather than suffering. Dr. Ronald D. Siegel is Assistant Clinical Professor of Psychology at Harvard Medical School, where he has taught for over 30 years. He is a longtime student of mindfulness meditation and serves on the board of directors and faculty of the Institute for Meditation and Psychotherapy. Dr. Siegel teaches internationally about mindfulness and psychotherapy and mind-body treatment, has worked for many years in community mental health with inner-city children and families, and maintains a private practice in Lincoln, Massachusetts. Our guest today is Dr. Ronald Siegel. Ron, welcome to Present Moment.
Thank you for having me.
Tell us a bit about your background. How did you come to have a meditation practice?
Well, my meditation practice began quite some time ago. I'm now pushing 60, and I began doing mindfulness meditation when I was in high school, and then picked it up with more enthusiasm in college. And it was within the context of the counterculture and people generally having interest in such matters. And it seemed to me like a very useful doorway into psychological growth and development. Now, when I first started practicing, I was very enthusiastic, and I imagined that by the time I was old, which I figured was my later 20s, I would be hanging around in various states of bliss and enjoying being entirely in the present moment, and everybody would love me. And, having practiced this over the course of a lifetime, I've realized that it is a far more complex path. And two of my greatest meditation teachers have been my twin daughters, who are now adults. And they would teach me in the following manner. We would be doing something like driving to the dentist and running kind of late. And I'd start getting frazzled and start talking to them in what they would affectionately call that voice.
As parents do, yes.
Indeed. And a few moments later, one of them would pipe up and say, "Hey, Dad, haven't you written whole books about letting go of things you can't control and just being with the moment? Don't you give workshops around the world about basically not trying to control things that can't be controlled?" And I'm proud to say that I never once responded in a way that got me reported to the Department of Protective Services. And now that they are adults, we can talk about this with more sophistication. They understand the scientific method, and I can point out to them that everything they say about my parenting is true. However, we don't have a control group. We have no idea what kind of parenting they might have been subjected to without these practices. And I'm convinced that it would have been a whole lot worse.
And you had a wonderful opportunity with twin girls. You could have raised one with mindfulness and the other without. You had a built-in control right there.
That's true. That would have been fascinating, but I might have been then reported to the Department of Protective Services.
So you had your own meditation practice, and you then coupled this with your therapeutic background and study. How did those blend early on in your training and education?
Well, interestingly, I was much more steeped in Buddhist psychology than Western psychology when I entered clinical psychology graduate school. I guess we should mention I'm a clinical psychologist and currently an assistant clinical professor of psychology at Harvard Medical School. And in the early days, I really came to understand Western psychology through the lens of Buddhist psychology. And I think my understanding may be a little skewed from some people's point of view, but I see the two as quite complementary.
So we're here to talk about a book you co-authored with Michael Erdang and Douglas Johnson, a book called Back Sense, A Revolutionary Approach to Halting the Cycle of Chronic Back Pain. Tell us what led the three of you to collaborate on the book. What prompted you to write it?
Well, it's interesting. What got me interested was a personal bout with chronic back pain. It was nearly 25 years ago now. I spent 4.5 months flat on my back with a herniated disc diagnosis. And the prevailing medical wisdom at the time was you better spend as much time horizontal as possible. Don't sit, don't walk, hoping that the disc would heal. And if it didn't heal within a few months, you were a candidate for surgery, but surgery had uncertain outcomes. So I tried the best I could to follow the doctor's advice, and it wasn't getting any better. I persisted. I thought after a while that all this lying around just didn't seem so useful. Maybe I needed a more active approach. And I remember going to see a sports medicine physician who said, if you don't stay off your feet and spend more time horizontal, you're going to be begging me for surgery in 6 months. I still remember that line. So I spent as much time lying down as I could. At a certain point, I realized I had a relatively sedentary profession as a clinical psychologist. So I had some friends construct, in essence, a platform couch in both my clinic office and my private office, and I began a bizarre parody of the classical psychoanalytic scene. I would be lying down on this couch while my patients would be sitting up wondering about my pathology and my prognosis. This went on for some months. I remember there were some particularly interesting points that got me in the direction that ultimately turned into the Back Sense book. One moment was when my wife made the interpretation to me. She said, it seems that you complain a lot more of the pain whenever we have an argument. And I thought, great, this is my penance for marrying a clinical psychologist. Now she's going to interpret this orthopedic disorder psychologically. But it was an interesting observation. Anyway, there was a fellow at work who had a colleague who I knew somewhat, who apparently had been miraculously cured of her back pain. She was a clinical social worker. She ran a residential treatment facility. And he kept saying, you've got to talk to Linda. You've got to talk to Linda. And I thought, what's she going to do for me that the Harvard doctors I had seen hadn't already done? But at a certain point with his insistence, I called Linda. And I said, hi, Linda. And she said, oh, yeah, I heard about your problem. She said, what are you doing? I said, I'm lying down. That's all I ever do. I was really quite a peach at this point. She said, why don't you get up and buy groceries? Your wife will appreciate it. And I thought, buy groceries? I'm disabled. I can't buy groceries. Are you crazy? And, I thought now on top of everything else, I've got a feminist cabal to deal with. I mean, I have nothing against guys buying groceries, but not in my condition. But I was so frustrated that I thought, maybe I'll push this a little bit. And Linda's idea, which was then a rather minority view on the matter, was that despite the orthopedic diagnosis, the vast majority of cases of chronic back pain were actually due to chronic muscle tension. So I thought, well, let me try this. I'll treat it as though Linda's correct. I'll push myself a little. And I had known from previous experience that if I were to walk about a city block, I would get excruciating pain shooting down one leg. And indeed, I got up, I walked about a city block and got the pain right down the leg on cue. I thought, well, I'll give it a shot. I'll push it a little further. How bad could it be? And I walked the equivalent of perhaps another city block. And then to my utter amazement, not only did I have pain shooting down one leg, but I developed pain shooting down the other leg. And I thought, well, this was brilliant. I'm sure glad I followed her advice. But actually it was, because according to my radiology report, with which I was very familiar since I read it virtually nightly, I was supposed to have pain radiating down one leg because the disc was herniated laterally, as they often are. So if I have pain radiating down the other leg, one of two things is going on. My first hypothesis was, now I've shattered my spine entirely and I'll be an invalid. But the second possibility was that maybe Linda was right. Maybe what was causing the pain was actually not the herniated disc, but some other process. And now that other process was causing pain down the other leg, even though the radiology findings suggested that it shouldn't be. So at a certain point, I took a leap and thought, let me just treat this more radically as though it's a muscle tension disorder. And I started moving more. And lo and behold, a couple of weeks later, I was better, like really better. I was sitting up, I was walking around, I had some discomfort, but nothing like the pain that I had had. And at that point, I set about to research everything I could about chronic back pain as a chronic muscle tension disorder, and found that there was a small but interesting literature about this, as well as many, many anecdotes of people who had the disorder resolved when they started treating it this way. Now, as I mentioned, I had been a mindfulness practitioner dating way back. I was so depressed, so anxious, and so self-preoccupied during the period of back pain that I had actually stopped practicing mindfulness. But once I worked my way out of the disorder, it occurred to me a mindfulness practice could have been extremely useful for resolving this problem. And it was out of that I started thinking, how might I work with other patients? And I spoke to physicians who were sympathetic to this view, and they started sending me some patients, and the patients started getting much, much better. Now, the way it turned into a book was that one of the clinicians, I had known him for many years, Dr. Douglas Johnson, but he was a very good friend of my good friend, Michael Erdang. And I had spoken with Doug on a number of occasions about this. And Michael's idea was this should be turned into a book to make this more accessible to a wider variety of people than just the folks you can see clinically. And so Michael's impetus was, let's put it together into a book. He was the literary coordinator, if you will, and helped pull it together and help with the writing. And Douglas Johnson contributed the medical side to it, and I contributed the psychological side to it.
So what is the structure of the book? Can a practitioner of mindfulness find some potential help for chronic pain issues?
Yes. What's interesting about the book and how it differs in some ways from what is now a fairly wide variety of chronic pain treatment programs based on mindfulness that are out there is the book combines mindfulness practice and a mindfulness-oriented approach with aggressive functional restoration, a kind of rehabilitation that says, get the body moving again, get the muscle strong and flexible again. Most of the mindfulness-based programs that exist, including those that exist today, a decade or so later, focus only on the psychological part and not on also pushing people to confront their fears of movement and rehabilitate themselves rapidly. So the Back Sense book does both. And the basic structure has 4 parts to it. The first part, which is essential, is to get a competent medical evaluation to rule out the small number, but important number of disorders that actually make the Back Sense program contraindicated. These are things like chronic back pain can be caused by cancer. It can be caused by a tumor in the spine. It can be caused by kidney disease. It can be caused by something called spondylolisthesis, where vertebrae have kind of broken and are sliding in such a way that it could potentially sever the spinal cord. These are a very small minority of people who have chronic back pain or suffering from these sorts of things, but these are the sorts of things that obviously require medical attention. As I learned early in my psychological training, it's very poor practice to psychoanalyze a brain tumor. Well, similarly, you wouldn't want to treat cancer as though it were a muscle tension disorder. So once you rule those out, the next step is to get permission from your primary healthcare provider, whether it's an orthopedist or a neurologist or even a primary care doc, for free movement. And the question that I encourage patients to ask their physician is this: do you have any good evidence to suggest that if I were to use my body normally, I would cause irreparable damage? And most doctors, those familiar with research, will say, no, of course I don't. They may say, well, I'd recommend against doing this, that, or the other thing. It may increase your pain. But that's not the question. The question is, will I cause damage? And there have been a number of studies, some of which were conducted by my colleagues here in the Boston area, that show that even very vigorous exercise, weightlifting, jogging, twisting, turning, vigorous exercise in the gym is quite safe for the vast majority of chronic back pain sufferers. So once you get permission to move, then the program has basically 3 parts to it. One of them is cognitive restructuring, meaning learning to look at the pain problem differently. Interestingly, if we experience our pain and believe that our pain is due to some kind of structural abnormality, then we're going to be naturally fearful every time we begin to use our body normally. That fear will tense up the muscles. The tensing of the muscles will exacerbate the pain and will feel as though our hypothesis is confirmed. We'll feel as though, see, I am damaged. If I use my back in this, that, or the other way, my pain gets worse. But really what's getting worse is the fear is being generated. That fear is tensing muscles, and those tense muscles are causing an increase in pain. So the first step is about understanding the condition, understanding how what we call the chronic back pain cycle, which is really this cycle of pain leading to fearful thoughts or angry thoughts, leading to tense muscles causing more pain, and it becomes a vicious circle. And we all know that tense muscles can be quite painful. If you've ever had a Charlie horse in your calf muscles, or perhaps tense muscles in your shoulders, you know that can hurt a great deal, even though there's no structural damage whatsoever going on. Now, once that cycle has been established for a little while, it quickly becomes chronic because people start to give up activity. They don't want to, quote, re-injure themselves. And as they give up activity, the muscles become shorter. You lose strength, flexibility, and endurance. You become more psychologically distressed, which causes more muscle tension, and the thing can get quite locked in to such a degree that I've seen patients locked into this for 1 month, 6 months, 6 years. I think the longest is about 35 years that I've worked with patients who were really, really disabled by this. And once they began to understand the problem differently, were actually able to walk away from the disability and actually able to regain full functioning. So the first step is this cognitive restructuring, which is really understanding the background of the problem and learning to look at it differently. The second step involves basically starting to move again. It involves facing one's fears of whatever the activity is that we've given up. And it could be anything from bicycle riding to vacuuming to sitting in the car to standing in the shower. Different people with chronic back pain have different constellations of fear and things that they avoid because they're afraid that it'll exacerbate their condition. And what you need to do is find a way to systematically begin regaining these lost activities. And it's outlined in the Back Sense book how to do this. The trick is to start with something that's relatively easy, not too scary, and you can do 3 or more times a week. And the reason for that is if it's relatively easy and not too scary, you're not going to have a huge increase in pain, in fear, and consequence increase in pain when you take it on. And if it's something which is pleasurable, you're more likely to do it. Like I remember one woman who had this for 30 odd years that I was asking what she'd given up. She said, well, I gave up vacuuming right at the beginning because my doctor told me that was bad for me. And I said, well, did you used to enjoy vacuuming? No, I hated it. I didn't know why I had to do it just because I was the woman of the house and on and on. So that would not be a good candidate for an activity to start with. And the reason for doing it 3 or more times a week is because whenever we begin an activity that we've previously given up, initially there's some fear involved and there's some working of muscles that are probably deconditioned. And the combination of the fear and the working of deconditioned muscles is likely to increment up the pain. If you do it 3 or more times a week and you keep going at it, then what happens is you begin to see that, some days I feel better, other days I feel worse, even though I'm holding the activity constant. And that becomes very, very helpful because the person can then start to decouple in their minds the feeling of pain with the thought that, oh, I've done this activity. And mindfulness practice comes in quite handy for both the cognitive restructuring part as well as this facing fears or resuming your life part. The way it helps with cognitive restructuring is when we practice mindfulness, and I take it your listeners are pretty much familiar with basic mindfulness practices at this point, we observe the thoughts that come into the mind. And one of the things virtually every chronic back pain patient observes when he or she starts practicing mindfulness is, my God, I have a frightened thought about my back almost every minute, sometimes several times a minute. I'm constantly redirecting my attention to where the pain is and asking myself, is it getting better? Is it getting worse? Did my most recent activity exacerbate it or make it feel better? And just seeing that is very helpful because it helps us to entertain the idea that, maybe my anxious thoughts really are playing a significant role in this. Mindfulness practice also helps us, as we all know, to not identify with our thoughts so much. So the anxious thoughts can come up, they pass through the mind, but we can let them arise and pass like clouds passing through the sky. We don't have to be so reactive to each threatening thought as it arises. Mindfulness practices also help in the second stage, the resuming normal activity or facing your fears, because there pain is likely to come up. And one of the ways you can use mindfulness practice to deal with pain is, instead of bracing and guarding and tensing against it, which increases both the muscle tension that creates pain and also actually increases the sensation of pain. Let me take a little detour here to explain that if you set up studies in which you subject a subject to physical pain by either putting their hand in ice water or applying a laser, which is uncomfortably hot, and if the person fears that pain and tenses up against it, the very same stimulus will be experienced as much more painful than if the person can relax into it and simply experience the sensations as a changing kaleidoscope of different bodily events. So mindfulness practice helps us to tolerate the pain that comes up. Now, the fourth part of the program is only necessary for some people. The first steps that I've just outlined are necessary for virtually everybody. You need to have a competent medical workup to rule out serious problems. You need to have some way to shift your understanding of the problem so you don't think of yourself as fragile and damaged, so you have the courage to start resuming activity, and you need to resume normal activity. Sometimes that's all it takes, and people really, their pain starts to resolve, they develop confidence in their ability to use their bodies, and that's the end of the story. Some people get to the point where they're able to use their bodies more or less normally, but they're still in pain. And then one of the questions we ask is, what might be maintaining the muscle tension? And the principal candidate for most of us is some form of emotional or psychological stress. In fact, we use the same word in English. If I say, I feel tense, it's an ambiguous term. It might mean I feel anxious, or it might mean my muscles are tense. We use the same word for both because these are unitary phenomena. They both happen at the same time. And mindfulness practice, we know, can be very useful for stress reduction generally. And in particular, mindfulness practice can help us to get in touch with underlying emotions. Because sometimes what happens is a person is having difficulty with anger, having difficulty with sadness, even having difficulty with sexual feelings towards somebody that they feel is an inappropriate object for them. And when those kinds of feelings come up, we suffer from what Freud called signal anxiety, which is this fear that arises. The stress physiologists say that the system, which is designed as a fight or flight system to respond to the tiger out there, starts to respond to the tiger within. And in this case, the tigers are all of these different feelings and thoughts that we're uncomfortable with. As most people know who have done mindfulness practice for a while, mindfulness practice helps to bring these things to the surface bit by bit, practicing awareness of present experience with acceptance. So if a wave of anger comes up, we can sit with and be with the anger. If a wave of sadness comes up, we can sit with and be with the sadness. Same for joy, same for sexual interest, same for many, many different kinds of feelings that arise in the mind. So when we use mindfulness practice to know these feelings better, we become this extra component, this extra source of stress and tension starts to resolve. And that's often very helpful for people who have already managed to get over their fears of movement and understand their problems differently.
This book came out in 2002, just over a decade ago. Have you found that recent findings about the impact mindfulness can have on chronic pain to be in alignment with the program in the book?
Very much so. There have been a number of developments over the last decade. The biggest development is mainstream medicine has really shifted. It was standard to send people to bed when the book came out. The standard now is to ask virtually everybody who's got a chronic back pain situation to do some kind of active physical therapy and to resume exercise. So that has been enormously useful because people can get much better medical advice now. Now, it hasn't entirely trickled down to the hinterland. There are still doctors who will preach caution, but larger and larger numbers of doctors will encourage people to move. So that's very, very helpful. There's a great deal of neurobiological research on mindfulness, which supports the approach in the book. One set of studies looks at experienced meditators and people who aren't experienced meditators who are subjected to experimental pain, like the kinds that I I described earlier. And they'll do this while people are in a functional MRI machine, which is a kind of, people know what an MRI is, magnetic resonance imagery. An fMRI, a functional MRI, is kind of a video camera of the brain as the brain is operating. So what they do is they put people in the machine and their head's inside of it. So they apply the pain usually to the foot, and they experiment with this. And it turns out that when people who don't have a mindfulness practice are subjected to experimental pain, the parts of the brain that register what's called proprioception, which is basically feelings coming from the inside of the body, is modestly active, but the part of the brain which is evaluating this and reacting to this is very, very active. And if you were to interview the subjects, they say, well, I felt terrible. The pain was very bad. And what's happening is they're feeling the pain somewhat, but they're reacting to the pain very strongly. More experienced meditators have a very different neurobiological response to the experimentally induced pain. What happens to them is the part of the brain that registers proprioception, that feels these events in the body, that part actually lights up even more than in the non-meditators, suggesting that they feel the pain more vividly. They're more connected psychologically to the experience of pain. But the evaluative centers of the brain, the higher cortical areas, are much quieter. They're not having a million thoughts of, oh my God, what to do? This is horrible. I hate this. All of the aversion responses, all of that kind of stuff don't occur so much. And their subjective report is, oh, it didn't hurt much at all. So that's a fascinating set of data suggesting that the general approach in mindfulness practice, which is to turn one's attention to pleasant and pleasant experience and try to be with both without a lot of judgment and without a lot of resistance, absolutely changes the experience of pain. And if this is the case, that's going to give people much more courage to resume normal life activities and work their way out of chronic pain cycles.
Our friend Dr. Fadel Zadon is one of the researchers who's doing the exploration of the neurology of mindfulness practices and pain, as you describe, and we've had him on this podcast. So it's a very exciting time to see the research come out.
There's also a study that just came out within the last week or so that showed that chronic pain patients' tendency to perseverate on and focus on their pain as opposed to focus on other events in their life. If you put people, they randomly assign chronic pain patients to an 8-week mindfulness group or an 8-week social support group, and found that at the end, the patients who were trained in mindfulness were far less focused on their pain than were the other group. And as a result, they reported much higher quality of life.
Since BackSense came out, what's the response been? Are there any particular personal stories that you could share?
It's been really fun to have been involved in that project because I do a great deal of traveling around the world largely teaching mental health professionals about the various applications of mindfulness practice in treating a wide variety of disorders. And virtually everywhere I go, somebody will walk up to me and say, oh, I had this chronic back pain problem and I read the book and it made sense to me and it worked. I really walked away from it and I haven't been struggling with this, in years. Or sometimes people will hear about the approach and they'll say, I had never read the book, but I figured it out on my own. I was told I needed surgery and I went into starting to do aggressive yoga instead. And, I got better. And so many, many stories like that come up, and it's very gratifying to hear them. I've also gotten emails from people from all over the world. One of the points that's made in the BackSense book, in order to help convince readers that they don't have to be afraid to use their backs normally, is the fact that these disorders are not evenly distributed across the world. And it turns out that the developed world, post-industrial countries, all have chronic back pain epidemics. But the third world has very light levels of chronic back pain. It's actually a rather rare disorder there. And in fact, in a WHO study, World Health Organization of a number of years ago, the country with the lowest frequency of chronic back pain was Nigeria. And there it was the rural farmers who particularly were free of the disorder. And these, of course, are folks who do back-breaking labor. They do not have ergonomically approved workstations. They do not sleep on, Posturepedic, top-of-the-line mattresses. None of this. They ride on the back of pickup trucks, bouncing over rutted roads, for hours to get to market. And these folks don't have the problem. So that's very, very interesting data. So anyway, I got an email and a phone call from a fellow in Australia at one point. He was from Melbourne. He had such a strong Melbourne accent. It took me a few moments to realize that he was actually speaking English because it was so different from my own accent. But he told me that he was so struck by that notion that this is a first world disorder rather than a third world disorder that he contacted the head of the Aboriginal Health Services in Australia. Because this is a whole other issue, but many Aboriginal people live as though they're third world peoples, even amidst the bounty of Australia. And he said, indeed, the head of the health services there said, oh yeah, chronic back pain is unusual in the Aboriginal population, particularly those folks who aren't living in the cities. It's much more an urban problem. Again, this would never be the case if it were really due to wear and tear on the back.
You were also the editor with Christopher Germer of Wisdom and Compassion in Psychotherapy, Deepening Mindfulness in Clinical Practice just last year. I hope you come back to speak with us about that and your book, The Mindfulness Solution, Everyday Practices for Everyday Problems.
Yes, the first book is more oriented toward professionals who have been already involved in mindfulness-oriented treatment and are looking for how the mindfulness-oriented treatment interfaces with some of the core teachings of Buddhist psychology. The mindfulness solution, everyday practices for everyday problems, is particularly useful for anybody who wants to take up a mindfulness practice themselves and use it to treat a wide variety of disorders, such as chronic pain, as well as other stress-related medical disorders, and things such as anxiety, depression, relationship issues, and the like. And that one's written for the general public and is a kind of, in some ways, serves as a broader update to the Back Sense book.
For those listening, you can learn more about Ron and his work on his website, www.mindfulness-solution.com. Our guest today, Dr. Ronald Siegel. Ron, thank you for joining us on Present Moment.
Thank you for having me.
Today's quote is from John Teasdale, Mark Williams, and Zindel Siegel's book, The Mindful Way Workbook, an 8-week program to free yourself from depression and emotional distress. If you have suffered long-term emotional difficulties, you'll have already discovered that worrying or suppressing doesn't really help. But you may feel powerless to stop it. Redoubling your efforts to switch off your troubled mind may give temporary relief, but it can also make things worse. Your attention is still hijacked by whatever is troubling you. It's so difficult to prevent the mind from being dragged back again and again to the very place from which you want to escape. What if it were possible to learn wholly new skills that allowed you to cultivate a radically different way of working with your mind? Mindfulness training teaches exactly these skills. It gives you back control of your attention so that, moment by moment, you can experience yourself and the world without the harsh, self-critical voice of judgment that may so often follow you around. Thanks for listening. If you'd like to hear more about something you've heard in today's podcast, please come visit the website at presentmomentmindfulness.com. You'll find an entire webpage devoted to this and every episode. You can comment on the episode page and find show notes and other helpful resources for your mindfulness practice. The shakuhachi music heard on Present Moment is used by permission and through the generosity of musician Rodrigo Rodriguez. His website is linked on the Present Moment website on the About Podcast Music page. Sound editing, mixing, and mastering provided by the generosity of Anthony Dominello of StructureFromSound.com. Until next time, remember, every moment you have a choice. Make it the best you can. See you next time on Present Moment.